Dr. Manisha Sharma. I stand before you tonight to tell you a patient story. This story is not about one of my patients. This story is about me. In my early 20s, I was in school pursuing my dream of becoming a dancer and a musician. That dream came to an abrupt halt. In 1996, while walking in a crosswalk, I was hit by a car. For the next 7 years, I underwent 4 major hip surgeries, extensive physical therapy, and accrued thousands of dollars in medical bills, even with private medical insurance. I, like many other patients I met along the way, had to learn a few hard lessons about our healthcare system. While recovering from my injuries, I also had the stress of dealing with my health insurance company. So there I was, a previously healthy 20-something who now needed continuing medical care to walk normally. And I had to fight with my health insurance company to get them to pay my medical bills, even while I was paying their premiums. And now, for the rest of my life, I've been pegged as a person with a pre-existing condition through no fault of my own. But you know what? I have a lot to thank the private health insurance industry for. For one, it inspired me. I had the opportunity to meet many hardworking Americans who were struggling to pay their bills and get the medical care that they needed. This motivated me to become a patient rights advocate. And since a patient's best advocate is his or her doctor, well, I decided to become a doctor. Through a lot of perseverance, and with the love and support of my family and my friends, I am proud to say that I recently graduated from medical school. A doctor who had no medical insurance. 9 months ago, I found myself without a job after graduation and therefore without healthcare coverage. In our current system, if you're not on someone else's plan, like a parent or your partner's, then you only have choices is to purchase a private health insurance plan or have no coverage at all. And you only have this choice if you can afford insurance in the first place. I did not have that choice. I cannot afford private health insurance. I have a pre-existing condition, so getting affordable coverage proved to be extremely difficult. But make no mistake about it, I actually was one of the lucky uninsured, as I had friends and family who could help me out if I got sick. Imagine the people who don't. Still, as a new doctor, I found myself falling into one of the many gaps of our broken healthcare system. I was part of that sobering statistic of nearly 50 million people who are working or looking for work who do not have health insurance. Finally, and thankfully, I did find a great job, and only because I have that job, I now have health insurance. It kicked in 2 weeks ago. I went into medicine because I believe healthcare is a right, not a privilege. Insurance companies that can choose what they're going to cover. We do not get to choose when we get sick. We do not get to choose when we get hit by a car. We need reform. It is time to deliver. Right now, we are at a critical time. We have never been closer to affordable health insurance reform. Right now. Even though the naysayers are trying to confuse and scare us, they're trying to tell us, no, we can't. That reform is too expensive, that it isn't possible, that your doctors don't want it. Well, I am here to tell you, as a doctor and a patient, they're wrong. I am one of hundreds of thousands of doctors who want our patients to be covered, regardless if they're in between jobs or have a pre-existing condition. At this moment in our history, we have the chance to have a choice. And this is in large part due to that leadership of our president. A man who made history with his election. A man who has called for change. A man who is just getting started. that have been fighting for change. After almost 100 years of pursuing health insurance reform, we, all of us, will help make history again. Yes, we can.